This is for obviously international medical graduates all over the world. But now there are so many resources out there online that you can use. Some of them are free, some of them you have to pay some money for. My dear friends, welcome back to my channel Bloom with Dr. Mahane. This is a much awaited video. I'm so sorry I couldn't bring it earlier than this, but I was quite busy with life and work. So anyways, now we are here. It's about the Australian Medical Council exams, the study materials that you can find online. Okay, so many people have messaged me after watching my how to find a job in Australia, how to prepare for or how to apply for AMC exams. Please check the videos as well. I'll pop the links below in this video. So many people ask me what are the study materials that they can use to prepare for AMC MCQ exam. So this is for obviously international medical graduates all over the world. So I found like when I did this was 10 years ago, and I used the AMC MCQ handbook, and yeah, that's pretty much it at that time. That was probably 10 years ago. But now there are so many resources out there online that you can use. Some of them are free, some of them you have to pay some money for them. So first we'll talk about the free resources. One of them are with heal.edu.au website. I'll pop the link below in the description box. So this offers you online webinars. They are free. So please go and register yourself. I'll just check the dates for you now. So they have AMC Clinical Preparation webinar as well as AMC MCQ Preparation webinar, which is online, and the next available date is 4th of October 2022 this year, and it starts at 7:30 p.m. Sydney Melbourne time, and it goes on for 1 hour. Please register yourself, guys. This will be giving you so much information about how you can get yourself prepared for AMC exam, how you can ace your AMC exams. And also there is a webinar for AMC Clinical Preparation as well, but I'm not going to talk about them today. It's all about AMC, Australian Medical Council MCQ exams. So that's one of the resources that you can find online, and it's not running for a long time. It's just 1 hour. Why not use your free resources? So secondly, there is another website. Again, it offers you a study guide for your exam. So if you're planning to do it next year, you can get that study guide. You can actually plan your study, and also they have 4,000 online MCQ question bank as well. So you will get to access it when you get registered yourself, and it says it is free on the website. I'm pretty sure it will be, and the website is www.ambos.com. again, link below in the description box, and it gives you a comprehensive guide about how to plan your study, and also it offers 4,000 questions as well. So why don't you go and check that out as well. And the AMC website is the next big resources that you can find in there. That's one of the biggest resources out there. So they recommend a couple of books to use, to read, to gather your knowledge, put your knowledge together. So one of them are Anthology of Medical Conditions, and the second one is Good Medical Practice. So you can purchase them through online in the AMC website. So the Good Medical Practice book is about $85. So please go and check it out on AMC website, and I really recommend you buy it because you're spending so much money on this exam and you don't want to repeat doing it. So get all the resources gathered around you before you go and give it a go, because it's a lot of money, guys. It's serious money. I don't want any one of you guys lose your money on this exam, because the big thing is about these AMC exams is once you pass your AMC exam, they don't guarantee you that you will get a job. So it's so important. Don't make it few attempts, make it just one attempt and get through it, and you can do it, I'm pretty sure, because you guys work in a very busy environment, busy hospitals, lots of clinical knowledge comes into your heads, and I think you can do it in your first go. So the other resource that I really trust and I like it, that is the website called iMeducate. So iMeducate website is an Australian-based exam site, and obviously you will have to pay money for it to get the subscription for you. So for AMC MCQ exams, you can get 6 months subscription and 12 months subscription, and before that you can test it out. It's about it is done through exam conditions. It's just gives you the times and you practice your exam on that website. So there are lots of practice exams available once you get registered and get the subscription. So for 6 months it was about $45. You have to register yourself using your name, email address, and the details they ask from you, and register yourself and do the free trial first. See whether you like it, and then you get a 6-month subscription for $45, which is really cheap, I think. So it's a good resource, because I personally have used it for my emergency medicine primary examinations, and it has helped me a lot to get through the exam. So please check that out. Yes, you have to pay, and always good things come with some sort of a price. Okay, you guys, I think there are so many other resources, but I haven't actually used them, or I couldn't go through each and every exam resource available online. So I will be a little bit careful about these paying sites. Also, you can get into some courses in your country if available, and also with MCQs, it's all about practice, and practice makes you perfect. Even for your clinical exam, practice, and you become perfect. So at the moment, you should not be worrying about your clinical exam, because lots of the questions that many people asked me, how long this AMC exam, MCQ exam is valid for. It's lifetime, guys. Once you've done it, you're done. So you don't have to worry about expiring your exam results. So once you passed it, first find a job in Australia, and then you get into the system, learn about the Australian system, how things works in Australian system, Australian hospitals, and how the OSCE doctors treat patients, how do they take a history, what are the resources they use, how they examine patients, how they plan their investigations, how they plan their differential diagnoses, and how they plan and come up with a treatment plan for each and every patient present to the hospital. So work across different subspecialties if you get a chance. Work in surgery, medicine, orthopedics, gynae-obs, pediatrics if possible, before you jump in and do your clinical exam, because trust me, the experience will make you a better doctor, especially working in Australia, and then it will help you to ace your Part 2 or AMC clinical exam. It's a huge amount of money again, but who cares? You're working, you're earning money, so why not? And also there is another pathway to get general registration, which is the workplace-based assessment system, and it doesn't you guys not by each and every hospital in Australia, the workplace-based assessment, because they are always into rural side of the country hospitals they offer it. So it will be really hard to find a spot, to be honest with you. So some people will must have to get through AMC clinical exam to get general registration. So those are the main resources that I wanted to tell you about today about AMC Part 1 MCQ exam. So and also I'm planning to bring another video about many questions that people been asking me about finding jobs, getting into specialty training, and I'm planning to get some of the international medical graduates who come down to Australia after AMC Part 1, Part 2 and who got into different subspecialty trainings. I'm planning to do some interviews with them in the future. Please give me some time, and I definitely will bring another video about how to get into specialty training in Australia. So hope this video was helpful for you, and good luck with your exam prep, and I know you guys can do it. You guys will be really better doctors. So check those resources out, use them wisely, and don't waste your time, don't waste your money, and also make sure that you pass in your first go. So that's my message for you guys today. Good